My name is Monique Rader. I currently live in Prescott, Arizona with Justin, my husband. I am here to see Jamie and Taylor for one, and Katie. And for two, Jamie referred me to a dentist, Dr. Taylor, for dental work, for oral surgery, because I cannot find a dentist that will work with me in Arizona. We only have 2 anesthesiologists, or 2 or 3 in our town. It's really hard for them to set up where they would work together with a dentistry, because a lot of dentists work in their office and unfortunately not in a hospital. Blistering can cause complications and risk, and they might need an OR for emergencies, such as maybe you could stop breathing due to a blister, where if you had oral surgery in an office, you really don't have the doctors or anesthesiologists to help you. They might not have a breathing machine so that they can intubate you properly, and it could just lead into instant death. For me, in my experience, every time I go to a regular dentist, as soon as they see how small my mouth is, it's just like a no-go for them, because they feel that they haven't had the experience enough with a small mouth. Even though some of them have worked with children, they still feel that, for one, our skin is so fragile, they're gonna just tear it up. They don't think, taking their time is really going to make effort to make you feel comfortable, So I think it's just they're afraid to even chance it, because they're used to just working in a mouth, and not a mouth that's going to have a blister or, skin comes off that might really get to them. So once you have teeth that start rotting, it becomes very painful. And the only thing you can do is have over-the-counter medicine, unless you're working with a doctor that's willing to give you Tylenol with codeine. Also, abscesses, which cause skin infections later. It's very dangerous. The abscess can spread to the bloodstream as well, which would be very hard to survive. Once, the immunity is immune to the antibiotics, then you have to go on another antibiotics, and then it's a cycle process. So it's just, and then over time, your body is not going to react to antibiotics. So then that poses a danger to, treating the infected tooth and the skin at the same time. Thankfully, my mom has taken very good care of my teeth growing up. There were dentists that said there's a possibility that I might, as I get older, I might lose all my teeth, depending on how I cared for them in adulthood. But so far, I've been blessed to have quite a bit of my teeth left, as long as I keep up the brushing, and they tell me which teeth can be saved and which teeth are going to have to go. The only reason why I've had teeth removed is because the space in the mouth, the jaw doesn't necessarily always grow, and I had to have 4 teeth removed in order for my wisdoms to come in, because I had an impacted tooth and it got infected, so they needed to remove those and to make room for the other teeth to come in. So I think I'm only missing one of my adult teeth, 1 or 2. Dr. Taylor has, she's very willing to, she seems willing to learn, and listen. It's not like because she hasn't had experience with it, she's going to say no. She just seems like the type of dentist that is like, okay, I see your situation and I will work with you. And, and she listens, and she kind of, it's just all about patient. It's not because of her knowledge, what she went to school about, it's more her personal experience with that person at that time. And she, she alternates for everybody. It's not the same thing for every patient, and I really like that about her. And she also guides, the dental assistants. When we were in the operating room for my surgery, she guided everybody to do what to do and what not to do. She talked up a lot for me, so I really like that about her. Growing up, I've always loved to smile. I've always been a big smiler, and my mom always taught me, because the doctors, they're concerned about the skin, and they recommend that you use a cloth and to brush the teeth of ED patients. But my mom said, there's going to be a little bit of bleeding. So she always used a toothbrush on me, and and the skin after sometimes it will get kind of used to it over time. Even the scaler, she'd go around the edges of my teeth and make sure that she would get the plaque off, and that has helped keep my teeth longer in better condition. And dentists were always very surprised how my teeth looked, especially for my age. And so, and as like I said, one of my features I like to show people is my smile, so I try to keep my smile in the best condition as possible. When I have good days, I'll eat a little bit more solids like pizzas or chips and stuff like that, but I try to keep my diet as soft as possible because there are chances that the enamel might be soft, and and if you bite into something suddenly that's very hard, you can chip a tooth. And I've chipped teeth before, so it's just really important that you kind of weigh out your diet and know what to eat and not to eat to keep your teeth longer. Hoping that even dentists that are just leaving school, just getting their dentist degree, they're still in the learning phase, so be willing or read up on it on your own to know about it. There are dentists willing to know about new things. They're not going to get it right away. It takes time. I know that we have limited space in the mouth, but I think it's very possible, to have any work done in the mouth, and also to work with a great anesthesiologist, and so no one has to suffer of the pain. You do have to expect there will be blistering. There will be a little bit of trauma to the mouth. You might feel tearing. There might be blood blisters. You might lose skin on the tongue. But you kind of have to endure it to get the work done that you need, because you much rather have a little bit of blistering in the mouth than to deal with pain in the mouth for months, maybe even years, and also risk yourself to infection with abscesses, and then it will spread to other teeth and you might lose all your teeth. Thank you so much, Dr. Taylor, for taking the time and the effort, and she made all those phone calls to find a doctor for me, and she sounded really concerned, and she stayed at the hospital all day and made sure that I was taken care of, and she just took a lot of time, and I really appreciate it.